My camera works finally. Yeah, hello everyone.
Hello everyone. Dear all the speaker and participant, I would like to welcome you all to the 15th edition of the Annual Information Security Summit AISS. In this particular track session, we would be talking about the theme Digital Health Mission for Security and Privacy, Framework, Innovation and Accountability Model for Multi-Stakeholder Ecosystem in Making. With a rapid digitization and adoption of advanced technologies, the healthcare sector has been facing an enhanced level of cyber risk and cyber attack. This in turn is creating a new sense of urgency for the healthcare sector to protect valuable and sensitive data. In this particular discussion, we will discuss about the cybersecurity challenges in the healthcare and strategies for ensuring a robust cybersecurity and data protection posture for this sector. Now, I would like to introduce the panelists for the session. We have with us Mr. Siddharth Bhattacharya. He is Secretary General with NAT Health, who will be moderating the session. Mr. JP Dwivedi, Chief Information Officer with Rajiv Gandhi Cancer Institute and Research Center. Mr. Dinesh Koka, Founder and CEO, Onward Health, and Mr. Rahul Gupta, Director Advisory Services with KPMG. Now, I would request Mr. Siddhartha and other panelists to present their view on the subject.
Thank you so much, and a warm welcome to everyone on this very important discussion. I'm very privileged to be joined with a very eminent panel who are all domain specialists and have a pretty exhaustive and end-to-end view on the subject. As all of us know, digital health, during the last year or so, it has really accelerated the transaction or the transition, from a healthcare which was primarily, offline, with pockets of digitization. There is an accelerated movement towards, using digital platforms to connect consumers with providers, payers, suppliers, and it is going to result in a massive explosion of healthcare data, which so far historically have been protected to some extent because they have been compartmentalized and they have been not been digitized. They have remained in legacy offline records. While it is going to speed up the pace at which healthcare information is moving around, it also throws open some very, very important risks. And particularly because healthcare data, unlike financial data, any particular leakage around healthcare could actually adversely impact. It is something that is irreparable. The loss is irreparable. In the financial world, it is a matter of only money, but as far as healthcare is concerned, it's actually about an individual's entire life, right? So to kind of understand these risks, we are going to engage with this panel, and luckily for us, we have a B2C perspective here, we have a B2B perspective, and we have a knowledge partners and advisory services. We have and Mr. Dinesh would have a view of many clients in one go. Maybe I will start with Mr. Dwivedi first, and my first question open to you, sir, is how do you see this transition playing out, right? From an earlier day, what were the kind of risks, the cybersecurity risks around healthcare data? With the recent transitions, what are some of the new elements of risks that you see, particularly from a B2C perspective, because you deal with customer data as a provider to a large extent? So over to you. Thank you. You are on mute, Mr. Dwivedi.
This is a very pertinent question, Siddharth. We are a very special country and very special society. If you look at the spectrum, people talking about, sitting around and allow and say, well, I'm hypertensive. Okay, what is your BP? It is 130 by 90. Oh, what are you talking? I'm 180 by 100. So people take pride in these things and discuss. Health has never been, a matter of very special protection or privacy. Historically, we talk so openly. And look at the other spectrum. The penetration of Amazon and Flipkart and likes of these so much that even in villages, people order everything online. And the moment you order an adult diaper, next day onwards you start getting messages and emails and everything. By the way, I produce better. So they exactly know, what are you up to, where are you going, who all are you talking to. Now, looking at the health subject, so far it has been very easy. Doctor has been writing prescription on paper, it has been given to the patient, or it is kept in a file that is in a vault. That's it. Now everything going online, people using, telemedicine app, data traversing from the hospital to patient, hospital to hospital. It is very much in the cyber domain. And these questions are now coming. Now, whether irrespective of whether I am a common man or a politician or a businessman or entrepreneur, you look at the risks. I mean, insurance companies are behind the data. Pharmacies are behind the data. Rival politicians, rival enterprises, they all are behind the data. If somebody knowing that, this particular is really affected by something very serious and probably life is only up to 18 months, you can imagine the influence that it has on the business decision. I'm just giving you an example. So risk is really, really high. And we, other than putting, technology solutions and all those things, I think, primarily need to work on culture also. Or, how we talk, how we walk, how we behave. It is all important, and really we need whole bundle of the preventive steps that we as a society need to take in order to ensure of the level that our peers in Europe and America are ensuring.
Thank you so much, Mr. Dwivedi. My question, the same question to you, Mr. Dinesh, from a B2B, more from a supply side perspective. How do you see this play out?
Sure. Thanks for the question. Just to give a background from where my perspectives I'll be sharing is, we provide workflow softwares, and our the clients that we work with are healthcare providers, be it hospitals or large diagnostic service networks, right? So one is the workflow software that we provide, and on top of that we also provide data-based platforms, right, or AI platforms. So each come with their own challenges or considerations, right? So if I had to put it that way. And so what we have seen, I mean, given my past, I've worked on the corporate side, having sold software on behalf of a multinational major to healthcare providers. So maybe I've seen the transition over 17, 18 years. So definitely, each of these silos or verticals come with their own challenges. But definitely have seen that clients or the users are much more mature in their outlook, or maybe the hand has been forced in terms of awareness. But just like JP sir mentioned, right? Definitely healthcare CIOs of today, right, across domains, have a lot more to consider, right, and are very sophisticated, right? So courtesy of the challenges that he mentioned as well. So there is heightened awareness, right? Prevalence of so many points at which data is captured, right? So that is the background to which we are doing. So given we're looking at workflow, like I mentioned, and the data platforms, right? Broadly 2 or 3 perspectives. So on the workflow, right, to at least specifically, we connect labs, right? So you can say a bit of cyber physical security as well, because you're adopting IT or technology, one, for convenience, right? I mean, reduce possibility of manual error. So you're using integration even at the device level, right, to get your patient demographics, because you don't want multiple points where there is manual entry of patient data. So you are integrating that, but courtesy of that, there is also the perspective of securing each of those assets, not just virtual servers or computers, but even those devices, because they are you're deploying APIs on them to import a lot of information as part of the workflow, right? So that is one perspective, and there is, as all of us would know, there's a fairly wide deployment, right, of these connected technologies. So that definitely introduces challenges. So those are the things that we look at as well, right, from a system security, and then comes the privacy of the data, right, of the pipelines that are coming out of those devices. That is from the workflow side. On the AI platforms, while the machine learning is more prevalent or more discussed today, it's always been around. It's the fundamentals of that is not different from from the other systems, right? It's equally at risk for security breaches or attacks, right? So Mr. JP mentioned, any kind of data is competitive advantage. I mean, be it even clinical data, right? So I'm to build ML models which are primarily meant to improve efficiency, optimize my way of working. So it gives me a competitive advantage. So I want to secure it for myself, right? So that is the perspective there. And then there are multiple ways that ML systems, uh, you know, can be affected or need to be secured against. So stuff like data confidentiality, right? There are things like adversarial attacks which can happen, right, at an ML level. Based on the techniques that you use, you may have something called transfer learning, manipulations which can happen. So that is also happening. So a pretty interesting space, but equally something you need to be aware of and secure. And then the third, the interesting aspect is edge, right? Most of, as we go forward, right, you can't run a lot of these models right from the cloud, right? So for whatever is obviously a lot of the systems are on-prem, and you want to give these computations at the edge, right? So there is significant effort needed to provide a secure platform right at the edge as well, even to enable edge computing as well, right? So those are broadly the three themes, right, across which we try to secure, and most of our discussions, what happens with these players that happens, and obviously a lot of things that we are proactively address. Obviously, a lot of these are also considerations that we hear from people that we work with, and then kind of address how do we secure each of those pipelines or the assets, and what are those critical assets, or what is the criticality of those assets for the client as well. Right? I hope that helps.
Thank you for really, creating a pretty nice overview and a landscape on the key issues. I'm not sure if Mr. Dinesh is logged in. Maybe while we have him back, the organizers are trying to get him back. One of the more major developments in the last couple of years, particularly which has come up in the last few months, has been the entire movement setting up of the National Digital Health Mission, along with a federated architecture for the healthcare stack, how the stack is going to perform. And obviously, it needs to be supported from a governance capacity with legislative actions, particularly the data security bill that is pending, which defines the criteria for privacy, data security, and other aspects. To what extent do both of you feel? Maybe we start with Mr. Dinesh. You, in the way this roadmap has been created. To what extent does the issues that you see get addressed through these actions that are pending or upcoming? Thank you.
Sure, thanks. So this has been in the works for quite some time, like 10, 12 years. I mean, starting from the e-health authority, and then what we're seeing. I think NDHM has been a great culmination of all of those efforts, and talks about a lot of clarity in the efforts. So to your question, I think from our perspective, I can give our perspective, and then the way we interact with our clients in terms of implementation. Where we are right now, I think the definitions are there, right? Most of the work right now is going into how to make it real, right? Meaning each of the parties, a healthcare provider or a technology solution provider or an SI or an implementation partner, what does it mean for them, right? So that is primarily where I think the next 6, 9, 12 months is pretty critical, because I think it will get clarified as to how do we implement. That is what is coming down to. We've done the blueprint well. I think we've got some very good people doing, actually thinking through all of these. Right? Next 6, 9, 12 months becomes important as to how do we actually implement. Right? Do we, how it gets mandated. One, right, from the way data gets stored. Second is, for people to plug in, right, be it solution providers or the way it is envisaged, right? So people who want to plug into things like data lakes, right? How do they, how would they plug into something like this into the network? So that is where we are, right? And some of the discussions that are happening even right now are will primarily, pretty critical. What gives us confidence is the people who are there at the table, and are pretty mature, team members who've been, be it, on the healthcare technology side, or been CIOs. So that is primarily where we are. What we are hearing is, you know, as a startups, right? So we run a startup organization. So one of the concerns that we keep hearing from a startup is what is the cost of adoption, right? What is going to be the cost of adoption, especially when we are looking at, unless you mandate it, you know. The objectives are, you never really reach the objectives of it, right? So, but by mandating it, what is the cost of adoption at multiple levels? I mean, there is a cost at multiple levels, right? So a lot of the innovation is happening. I can bring the startups perspective, right? So there's a lot of innovation happening at the startup level. Clearly the blueprint mandates it's there so that you protect data confidentiality, privacy, and security, right? But at what cost? So that is still kind of an unaddressed point. I mean, it will be good to understand along the process, right? How that is, some kind of clarity around that is something that it will be interesting for startups to know.
Over to you, Mr. Dr. Dwivedi, please, for the same question. Thank you.
Yeah, Siddharth. So I keep explaining I'm not a doctor professionally. So yeah, NDHM is a mission. But more than that, PDPA, Personal Data Protection Act, is in the offing, and that very clearly defines basically what all are we trying to protect. So everywhere there are certain information jewels, if you like. So for example, your personal identity, income, health status, there are any allergies, any problems, sexual, all those aspects that people can take advantage of or could make you vulnerable. So there is a list of the data elements which are subject to this protection. Second is how this data is captured and how is it traversing all the levels where it passes through, and then finally where and how is it stored. So there are provisions. Let us say we are capturing heartbeat or sleep patterns or everything through wearable devices. Now these devices are connected to a certain gateway. Through that gateway, it is going to certain application. Through those applications, it is processed and then finally being stored in some sort of the data management system or a data center somewhere in the world. So there are agencies that are responsible. So there is an agency called data fiduciary. So all the hospitals, for example, will be classified as significant data fiduciary. These fiduciaries are guardians of the data. Now they may not necessarily be processing the data. So there are agencies that are called data processors. All these have their specific obligations to the data owner, which is the public or patient or whose data is being stored. So with these very specific accountabilities, responsibilities being put in place, there are penal arrangements also. So it is very clearly defined, it will come, that this is the kind of penalty that will come your way if you fail to comply with the norms. And then these hospitals will have, all the data fiduciaries will have a data protection officer who will liaise between the data fiduciary and the data protection authority that will be constituted under this law. And there will be tribunals, appellates. So complete arrangement is coming very soon. But that is the legal kind of framework. Of course, as I said earlier, technology must support all this. So we must exactly know what real threats are. And the old-fashioned, castle and moat style of security will not work. People are talking about zero trust network now. Employees are traveling and across the globe. So you cannot really put a ring fence around your data center or information center. So tools like web access firewall, tools like zero-day attack prevention, those are all available. Problem is not only of the need, problem is of the plenty also. Because for us like CIOs, we spend significant time answering these cold calls, and we don't know which one is significant, which one we should attend to, ignore. So sometimes, I would reluctantly say that we end up doing rag picking also, but we do it. Attending to thousands of the conversations, and eventually, coming out with one meaningful conversation that will give us what we need. But, cookie cutter approach will not work. We really need to be very thorough. This is one of the most fundamental pillars. Security is the aspect to ensure continuity of our business. And, put that reassurance in the mind of public and our patients that their data is safe with us, and whatever they are divulging by accident is not going out to the hands where it should not reach.
So thank you so much, Mr. Dwivedi, for making a really complex subject very easy to understand. Welcome back, Rahul, and great to have you. I guess maybe you can just quickly touch upon the two issues we have been deliberating. One is the nature of the risks that the new digital health, with the whole explosion of data sets. What are some of the new risks that you see ahead, and to what extent India's the evolving regulatory landscape is ready to compensate for that risk? Are there some good examples around the world where India can look forward? Obviously, as both our other esteemed panelists talked about, it's not a few months or not even a few years roadmap. It's actually going to be the next 5, 10, 15 years roadmap ahead. What are some of the collaborations or good examples where India can really learn from to get it off the ground? So any thoughts, Rahul? Over to you. Thank you.
Sure. Thank you. So first of all, apologies. I think the Meridian component kept throwing me out. So technology works best when you need it the most. I think somewhere we need to congratulate DSEI and the galaxy of speakers over here. The time is very opportune for having a conversation on security and privacy, and specifically in the healthcare sector, for what this whole year has taught us. And I think I will try and address your second question first, Siddharth, which is the mindset with which the government of India is looking at, taking the national health policy forward. In fact, it is just of yesterday. We're hearing news of the draft health data management policy, which is this is the fastest approval probably one would have seen. Now, I think what is important here is India certainly needs a very definitive framework which acts as a guidance for this whole ecosystem which forms part of the national digital health component. It's called NDHE. Now, we are very happy to see that government has considered, Government of India and Ministry of Health has considered certain recommendations, which is towards three aspects. So first is on the roles and responsibilities. I think I just heard, I missed part of the conversation, but I heard, Mr. Dwivedi talking about, there are clearly distinctively 6 roles being highlighted here, which is from your data fiduciary, data processors, and we're very glad to see that there is a talk on the data privacy officer and a CISO also to be appointed. Now, this brings a very fundamental things to fore, which is privacy in the hands of common man citizens like you and me. And this is where I think the principle of security by design is, now we're getting to see that it is getting embedded, at least in the direction of the government of India is thinking. I think what's also important is now there is a clear sense of direction of what is it we're trying to protect. Risks, the risk universe is really wide. The threat surface is really wide, and it becomes even more tricky when you're talking about personal data and sensitive personal data, which is in the case of healthcare sector. So I guess there is a clear direction which is also emanating on what is the kind of data we are trying to protect, which is your 4 kinds, at least that we get to see, which is electronic health records and medical records, so and so forth. I will touch upon the third component, which is where the whole principle of security and privacy by design is being now seen in the thought process, in the mindset of the way government is, at least government in India is moving. And this imbibes a lot of what we have seen in the data protection bill. It is still in the draft stages, as you all know, and there are certain overlaps, but it is a good harmonization, which we get to see over here. Now, take, for example, data fiduciaries takes a very significant role in terms of what their responsibilities are, and there is a guidance towards they need to be ISO 27, some international standards to be followed by them. Mr. Dwivedi talked about hospitals who will be in that role. And similarly for, both the data processes as well, it is important that they follow certain international standards for the record management. Overall, it seems to be a good package which has got all the right ingredients in terms of taking the National Digital Health Mission, or call it the single source of truth, to have where does India stand on the digital health. It seems to be a good direction. Now to your second question, Siddhartha, which is what, how do we, what is it that we are seeing across the world? As you all know, Australia, in the UK and the US, they onboarded on these journeys much earlier on. They had a very peculiar issue with respect to the identifiers. What is the single source of identifier basis which the beneficiary can be granted rights? And I think I would now again come back to India, wherein a learning has been spoken that we are talking about an identifier as a national digital health identity to be issued to the citizens of India. What is it going to write on? There are talks about should it be Aadhaar, should it be on UIDI's Aadhaar, which again seems to be the flagship digital identity and a case study across the world. So I guess there are, I think the thinking is in the right direction as far as Government of India, Ministry of Health, and I think we need to congratulate the efforts of the various stakeholders who have been part of this whole draft digital health data management policy. Yes, we need to look at the right capacity building. We need to look at the right infrastructure for implementation, and also somewhere we need to see that how prepared our hospital, the whole ecosystem, which is physicians, technicians, laboratories, the payers, the National Health Authority, which is going to be the governing body to implement certain things. How prepared are they? I think that's a direction that needs to be kind of worked upon.
Thank you for that, Rahul. I think you may have touched upon a very important point, which is The devil ultimately is going to be in the details and the way it is rolled out and implemented. And this would require a coherent thinking around financing, possibly public-private partnership that clearly defines the roles and responsibilities, as well as bringing the entire ecosystem and creating a visibility into what the transitioning costs are, because it is a mission-critical business, and nobody wants to. I mean, you kind of have to keep running your business while adopting to these changes as they unfold. Where do all of you, and to supplement all of these, you will ultimately require probably a next generation of skill sets in terms of manpower capacity, who really understand the nuances. I think Mr. Dwivedi touched upon the need for data information officers at different nodal places, and you require a certain critical skill set and a capacity to be built in the system. So I guess my next question to all the panelists is for you would be, where could some of those public-private partnership opportunities be? What is the rights and responsibilities of the key stakeholders involved? What does private sector have to do? Government is kind of going and leading it. At this point of time, there is a joint effort. Stakeholders are engaged. When it comes to implementation, how do you see this unfolding?
So let me make an attempt. The enforcement has to be by the government. Private players are the facilitators and solution providers. Rahul touched on the interesting subject, that is data privacy by design. So what is it? Basically, poison only can kill the poison. So it is the technology that has created this chaos. And there has to be a technology that will deal with this chaos, right? Machine learning, AI, Internet of Things, these are the big proliferators. They generate a lot of data and cause traveling of data through the mediums. Same AI techniques, same machine learning techniques need to be deployed to surveillance of the network and see whether there is an abnormal pattern of data or packets traversing here and there, and try to identify and assess where a potential attack could be coming from. So private sector really has a lot to do in coming up with robust technology solutions which work across the board, across the industries, across the stakeholders, the processors, the fiduciaries, the end users. And government has to work on the enforcement. There will be policies, there will be procedures, there will be technology, there will be a lot of infrastructure. All that combined will give the solution to the problem. So each player has its own role in this entire ecosystem. And when they work cohesively, then only I think we will be able to really achieve what we are trying to accomplish. It cannot be by government only, it cannot be by corporates only, it has to be a combined effort. A lot of knowledge propagation, training, convincing, enforcement together will make this happen.
Excellent. Anybody would like to add anything to that?
Sure, absolutely. I think I would agree with. I think it's a brilliant point of view with which Mr. Dwivedi has brought out here. I will again, probably zoom in a bit in terms of how various ecosystem partners. If you look at the whole national, the health ecosystem that we have, it's fairly complex. There are a number of players. I think coordinated, collaborated, co-created effort is one aspect, but incentivization is another. I think it is also the time when the startups in the healthcare sector needs to be kind of incentivized to come with a lot more innovative solutions, which can really help propagate the implementation of this whole public-private partnership model when we get to the implementation stages. I completely agree. This is not a single stakeholder responsibility, and it can never see the fruits of it. We have seen in our country how regulation drives compliance, but enforcement becomes an integral part to get the right results. So I think somewhere as we get to the implementation side of things, we need to create a very cohesive ecosystem, which is based on incentivization, which is based on standards that are written very clearly. Case in point here, IoT has been spoken across sectors, but I think the definitive use cases are far more forthcoming in the healthcare sector, robotics and a whole lot of things. So I think we need to look at a mix of things. There is no one clear kind of component, but then it's multiple things that has to kind of come together in a model that is that can help you implement the whole policy that has been spoken.
Yeah, I can just add a quick point. I mean, because the perspective here is the security. So from NDHM, one thing that we are also already plugged into, at least as a startup, is on the sandbox, right? So there has been a proactive effort, and in fact, it's a continuous effort since September around using the sandbox to give kind of experimental playgrounds for different around APIs, right? Trying to plug in and then test out, right? So that's primarily around getting the application to work and across the stack, but the same place could be used to also evaluate around how secure are those, right? Are those implementations, or are those the gets and posts, right? I mean, incoming and outgoing, right? So that is a place where since we've already created a sandbox, it's a pretty decent environment, and there is an intent already. Maybe so specifically to your question, I think that in itself could be scaled to the next level to add the security angle to it and scale it up as well. So that could it's already a PPP kind of an initiative where you've created this open kind of ecosystem. So that in itself, scaling it will help people who are already participants there, right? So we as a startup are already participants there, then getting us to scale, because then we get to evaluate, right? What does it in it for us, one, and but what does it entail, right? For us to be in 12 months or 24 months, right? Where do we need to be, and what does it mean for us, right? So that's a good example where we have at least seen from an application side, can just the same, you can use the security brush also to paint it, around the same place.
Well, just to add to this, I guess somewhere, we need, Dinesh, you brought in a very pertinent point. Somewhere we need a road to implementation. All the great thinking, the blueprint and policy think tanks, we have kind of come to a point, but I think the test, of the whole aspect is when rubber hits the road, and which is where we need a very clear, roadmap to implementation, where all ecosystem partners, they come together and they are very clearly, there is a directional view of what is expected. So I guess I agree to you what Dinesh, and of course, Mr. Devedi, what you have shared.
Excellent. Let's take some questions. We have one here, and anyone, you can pick it up. Feel free to add any points. This question is from Mr. Venugopal. It says, with the new PDP Act expected soon, have you already started any initiatives with your healthcare information systems to be prepared? If so, what are the steps and measures being taken? Are there any useful checklists that can be used as standards?
Yeah, absolutely. So fortunately, I'm also part of FDPPI, that is Federation of Data Protection Professionals in India. So I have some visibility what is there, and all these aspects that we discussed about have been relayed to our hospital information system application provider. We are working with them very actively and make sure that we are ready before the act comes. We are anyway almost ready, but still we are actually tracking all the nuances. And as I told earlier, what all are we trying to protect? So, PDPA very clearly specifies that these are the information elements that are needed to be protected. Where the anonymization and pseudonymization is required, that is also very clearly defined, so that any information that passes between systems does not inadvertently pass through anything which is sensitive and could be misused. And then making sure that all the entities that are processing or keeping or capturing the data are checked for any inadvertent leakage of the data. So all these aspects are very much on our radar. And I think the same will come to all the hospitals who will be using online systems in any capacity.
If I could, just kind of elaborate, both the standards, the PDP is more like a bill, and the draft health management policy, they both are very encompassing. Yet there are certain nuances, peculiarities. PDP is very industry agnostic. However, the HDMP, the health data management policy, is very specific for the healthcare sector. There is one other aspect which kind of very clearly differentiates both, while there is a lot of harmonization and we need to see how this all spans out, is with respect to the data fiduciaries. In case of healthcare, the data fiduciaries are required to implement a leading information security management system, and a reference to ISO 27001 has been given here, which is kind of not the case. But broadly, if you see, both, it's a very pertinent question, whoever has brought it, both the standards, they talk about data privacy and security by design to be imbibed and to be implemented by the usage of privacy principles across the literature. So I just thought to kind of augment that, Mr. Dwivedi.
Sure.
So we are almost, we probably have time for one quick question for all of you, and maybe we can just go around. If you take a year to 2 year look ahead, what are the one or two things in terms of key milestones that you think should happen that will make this agenda stronger from a data privacy and security perspective, and it will instill the kind of confidence in the digital health system which is still evolving?
Sure. Okay. As a startup, we are in very initial. It's been a couple of months. I mentioned the sandbox, right? So that's given a good, example or good view of what it will actually take, right? It's still very preliminary, right? So if you have to know, is it a good view of where we need to be in 2 years' time? It's an okay this one, right? So one thing for us is for us to take it seriously. Right, I think covers all of the points. All the points that we discussed during this is, where are we going to be? I mean, is this a final structure in which, what is the final way that we are going to implement? How can startups be part of this, right? So there is still a cost for us to completely move on to this and open up and set up all those APIs and be, completely compliant. There is a cost, right? So can there be some clarity around, how do startups pick up this cost, right? Startups are most of our investment of resources goes into innovation, right? So just if we have to invest resources into these pipelines, it is fair amount of effort and resources. In terms of the cost benefit analysis, it's not completely clear. So that would help, right, from a startup perspective at least, where we need to be and what will it take for us. The sandbox is a great example. We've done those experiments; they work, and it did require some effort, but we know that for the eventual implementation, it's going to be at least 4 or 5 times of that effort, whatever we put in already. Yeah.
Okay. I think India is at a point of inflection, as we kind of understand, and I would comment to say that regulation, legislation for a clear direction, I guess that would set a lot of tone in terms of how we look at India as a country and what is the state of maturity we want to achieve in years to come. Lots has been discussed. We are talking about cybersecurity policy of 2020, which is going to be very overarching. There is a sectorial direction, which is by the way of the data management policy for healthcare, the National Digital Mission, and of course, PDPV itself is in the passage. So I guess a lot would get, a momentum would be set once we have the regulation and the legislation, which will also drive a whole lot of compliance. So that's my 2 cents.
I see a couple of things happening in the next couple of years. One is I see something like National Health Information Highway coming up. So anybody who is compliant to the rules and regulations of that highway will be able to do the business. Just like Central Electricity Deregulation Act in UK, if you remember, late 90s. So that will come eventually. It may come in a couple of years, it may come in 5 years. And second, I see that we have a latecomers advantage. As today, GDPR is referred as the gold standard. I really look forward for a day when our PDPA will be looked upon as a gold standard for world to ensure data protection and privacy.
I think all of you have beautifully captured it. It is a highway, shining new highway ahead, with a lot of traffic from the most populous country in the whole world, where digital adoption is pretty high, and it is with healthcare, it is going to be even higher. I think, Dinesh, you have made an excellent point in terms of the ROI, particularly for those organizations that has to put precious capital, the smaller organizations, into complying and buying that toll ticket so that they are able to drive on that highway. They would certainly want a value to be put on the price of the ticket. And Rahul, you have said in terms of the signages and the rules of the game, who drives what speed they can drive, what are the level playing field, how does it look like? I'm sure those are some of the things that will come up. But what is most encouraging is the fact that all the panelists strongly feel that this is the backbone around which digital health needs to come up. If this doesn't happen, then it is not going to scale our goal of a $5 trillion economy or a digital health powered India. I would like to thank both NASSCOM as well as Data Security Council of India for hosting this very important agenda as a part of their annual security summit, the agenda around data security and privacy. And we certainly, in this annual conference in the coming few years, I'm sure we'll come back and revisit this particular discussion that happened today. I'd like to thank all the panelists for taking their valuable time and sharing very, very key insights into what the road lies ahead. With those words, I'd like to hand it over back to the organizers. Over to you. Thank you.
Thank you.
Thank you, sir. Thank you, speaker, for such a fruitful discussion, and I hope the participant must have gained from it. Thank you once again.